Before the holistic worker model was developed, we had a team of multi-healthcare professionals, OTs, nurses, physios, mental health workers, and the need of the patient at the point of assessment wasn't always obvious. So it may be the physio that went in when actually the greater need might have been for an OT or for a nurse. So that meant that there were multiple assessments taking place for the patient, which took up their time, and they had to repeat their story over and over.
So how are you doing, Ted? How are you feeling?
So the holistic worker model itself is designed to reduce the number of hours of assessment that the patient has, but doesn't reduce the outputs or the outcomes for that patient in any way. So what we do is each of the workers, whether they be OT, nurse, physio, mental health or social care, are skilled up to a certain level in each other's disciplines, and we focus on the assistant practitioner level, so the band 4 worker that many people will be familiar with. So myself as a nurse would gain some lower level skills in OT, physio, mental health care, which means that I'd be far better equipped to assess the patient at the point of contact, but it also reduced drastically the number of hours of assessment that the patient had to go through. The service was initially commissioned by our clinical commissioning group as an urgent care service, so it was designed to for patients to be assessed to prevent them going unnecessarily into hospital or into long-term care admission. So it's very much workforce driven, led by the nurses and their clinical colleagues.
This is the very first time in my life that I have had any care like this before, and I can only say that this team have been absolutely fantastic.
So Lorna had a fall and then had some fractures, so it was about just getting her back to her baseline mobility really. The initial assessment was done by a mental health nurse, and they would have looked at your skin on the first day.
Absolutely,
Lorna,
yes, yes.
Looked at any pressure needs, would have looked at medication, would have looked at any care needs. At that time, Lorna didn't need any. She was managing medication independently, stuff like that. The only real need was physio. The mental health nurse did look at what she was mobilising with, check that she was safe to do that. So that holistic work in there, she was able to assess that. And then for a deeper, in-depth physio assessment, she then referred on to us.
We had a patient and an initial assessment could quite clearly see with other health problems he also had mobility problems. Instead of referring to a physio, we could order equipment to help him safely get around the house, therefore probably preventing any hospital admissions and definitely preventing a fall, so increasing his safety with just one visit.
And I think for patients, if you've got somebody coming in and being able to look at what the whole situation is and identify things straight away, then problems get solved much more quickly.
The mental health issues weren't being picked up by other practitioners, but since being involved in this project, the mental health nurses working in the team have been able to give skills to other workers, so they'll be able to pick up things that weren't picked up in the past.
As a result of the role, we've seen the number of assessment hours drastically reduced from approximately 4 hours down to 1 hour per patient, and that's just because of the broader range of skill sets that our clinicians now have. But the outcomes for the patients have not differentiated at all. They're still as good as they were, and patient satisfaction continues to be high, usually over 95% for our patient surveys.